Let's look at data that we can gather from our health information management system. Every one of you likely is using a different EHR. And so if we can collect this information, we're able to report on many of the metrics that EDBA is interested in and you likely want to see on a regular basis. Here we see arrival information, again, easily sortable by provider, by date, and by site. We allow you to see both the EDBA benchmark and your individual benchmark over time for these metrics, including arrivals per hour, arrivals by ambulance, patients per day, and the number of PEDS patients that your facility is seeing. This arrival heat map can help you in staffing your department, knowing how many patients are arriving per hour at a specific site at particular days of the week and hours of the day may be helpful. When looked at for all sites, this is likely not going to lead to any useful staffing changes, so the better way to use this particular chart is to focus on a particular clinical site. Here we're giving you basically demo data. The numbers obviously appear quite low, but when representing data for your actual site, you should be able to use this to quickly visualize when are you seeing increase in volumes during the day. Disposition data here, again, closely resembling EDBA established metrics for left before treatment complete, transfer percent, admit percent, disposition types, and so forth. Again, easily drillable by site and by disposition type. We can show an example here. Moving to admit basically shows you data for admitted patients only. Order information, again, if the number of EKGs, chest x-ray, ultrasounds, MRIs can be captured, we're able to display all this data. Obviously, CT would be included as well, even though not visualized here. And we could look at these rates for particular providers or for each site as a whole, which then can be coalesced into a single data set, which can be used for EDBA submissions as well as better understanding resource utilization by your providers. Time interval metrics, again, important in order to understand differences between providers, site performance, and your performance as a whole. Pretty self-explanatory. We show performance by month. We show the median length of stay here and the length of stay for admitted and discharged patients for the entire group. Again, easy to focus on a particular provider if that becomes interesting.